Hi guys. I wanted to make a video where I talk a little bit about movements that can be helpful to prep the pelvis for vaginal delivery, because this is something I get asked a lot about. Um, and one thing I'll say is there's not a one size fits all. All deliveries and labours are different, but I will do my best to make a video that's helpful for you. Some of these movements require quite a high level of flexibility, and I will do my best to do alternatives. One of my main goals is that I use as few pieces of special equipment as possible. So I do have a Pilates ball with me. If you have kids and you have like a beach ball, or like those balls you can buy at the dollar store that are nice and squishy and that kids play with, those are perfect. It doesn't have to be like a Pilates ball. So yeah, you could even use like a soccer ball. Just something that has a little bit of resistance, but I'm going to give alternatives as well. So one of my favorite things to use instead of a squishy ball like this is just a pillow folded in half. Okay, that's enough of me blabbering. So our pelvis, as baby's coming through the pelvis during labour, first it needs to open at the top of the pelvis, which helps the bottom of the pelvis close a little bit so that baby can descend into it. And then it needs to come through that middle part of the pelvis. This is often where baby can get stuck. And then kind of right at the end, the bottom of the pelvis needs to open so the top would close a little bit as baby's head's coming through. So we're going to do kind of 3 different variations to try and help that happen. And I'll give you a couple of alternatives for some of them. Okay. This is not an exhaustive list by any means, but I just wanted to put a resource out there for people that I work with, people who are on my YouTube channel for some reason. So we're going to start with ones to open the top of the pelvis. So a really nice one is like a child's pose type position with external rotation of our hips. Okay, so we're kind of aiming to open up the hip bone kind of area with this one. So you can kind of come into child's pose with your knees wide and feet in. So that's external rotation of our hips. And you can either have your elbows bent or you can kind of come into full child's pose like that. Okay. And then if you just breathe here, let your pelvic floor relax. So imagine you're kind of opening your vagina up, spreading the sit bones, relaxing your butthole. It's really opening that area. Sometimes it's helpful to imagine just really letting your belly relax as well. Let the inner thighs stretch. Just breathing steadily here. Now, if this is kind of uncomfy on your hips, you need a bit more support, you might take a couple of rolled up towels, place them in that space, just to give you a little bit more room. Okay, you can put them nice and wide so they're not kind of squishing baby here. You might also find that you need a bit more support behind the knee. Maybe if you've had like a knee surgery and that deep flexion of the knee doesn't feel good, right, that could be another way. Okay. An alternative that isn't very friendly if you don't like that deep neck flexion of your knee, but can be adapted, is a deep squat or yogic squat. So for this, if you have a ball, great to kind of sit on it. You might have the flexibility to go without. I'm just going to show you a few things I found around my house that could be used instead. So I had like a tiny little garbage can. That's perfect, right? If you have a little stool, that's great. Even a stack of books would work, or even like a yoga bolster, a pile of towels, right? There's literally anything you can kind of sit on and give yourself a bit of support. Might be like a low coffee table, right? Or a stack of those things, depending on how much flexion you've got at your ankle joint and at your knees and at your hips, okay? So getting into a nice comfortable position. It's important that we're comfortable so we can relax into it. Okay, I'm going to use my ball here. Again, that outer rotation with the knees and feet are pointing out a little bit It's going to help the pelvis to open. Then we can breathe here. Again, imagine we're opening up this area at the top of the pelvis. Relaxing the butthole, opening up the vagina. You can play around with leaning forward or back. If you're practicing pushing, you might even want to kind of think about breathing down through your inhale, breathing down through your exhale with a gentle pressure. Inhaling down, exhaling down, opening up that pelvic floor with both the inhale and the exhale. Good job. Okay, nice. So those are kind of for that early stage. When it comes to that middle stage of labour, where it can be a little bit trickier, we need asymmetrical movement. So for most of us, a really nice way to achieve that is like a bit of a lunge where we're opening up through the kind of front of the hip. Okay, so if you have one leg forward and one leg back, this is a really strong stretch for a lot of people. Okay, you want to tuck the tailbone slightly. Okay, into a bit more of that tuck, and then again get yourself comfortable. So you might need to pad the knee just to make your knee more comfortable. Okay, and then you can kind of walk around into different levels of stretch. You might need to support your hand on the wall so you can really relax into it. You might find that this is enough of a stretch, right? So again, it doesn't want to be so uncomfortable of a stretch that you can't relax and breathe into it, because that's not where we're going to open up our body. Okay. So let's have a bit of a look at that. And again, you can do this one set on each side. So you might kind of find your opener, maybe even kind of reach the arm up so we get that kind of front body stretch. Breathe into it, steady breaths to relax the nervous system and reduce any muscle tension. Visualizing those joints of the pelvis opening up. And then you can start to kind of angle the knee and the foot out to get a little bit more of an opening. Bit of an opening through the pelvic floor and the inner thigh. You can kind of oscillate back and forwards if that helps your body to open a little bit more. Just staying in control, not kind of bouncing into the end of your range, but keeping it gentle. Nice. Same on the other side. Starting with kind of just holding that stretch, maybe bringing the arm up if you want a little bit more of an opener. This is the psoas muscle. It's one of our hip flexors and it connects onto our low back as well. Breathing here. Remember, we want to keep it back off of that uncomfortable part, right? It doesn't want to be painful. Remember to keep tucking the tailbone slightly. We're opening up between tailbone and pubic bone and then the two sit bones. We're making space. And then kind of maybe that rocking forward and back with the knee and the foot pointed out a little bit more. Good job. Okay. I'm just going with a range that feels comfortable. Like I said, you might find that if you do this kind of, every week, you find you might be able to get a little bit further, right? Just going with your body. Okay, so that's kind of mid-stage. And then for the final stages, we really want to open the bottom of the pelvis, so kind of our sit bone area. So that's where we need a little bit more internal rotation of our hips. Okay, so for this, we might want to come into that child's pose type position. again, but this time with our toes pointing out and our knees pointing in. Okay. Now, one thing that can help is getting our adductor muscle group on a little bit to help facilitate that internal rotation. So you can grab a ball or a folded in half pillow and place it between your inner thighs. Okay, so it's these muscles here. They're a big muscle group, okay, but right on the inner thigh. They get tight often during pregnancy. Okay. So you're going to be coming down, resting on your elbows, okay, or maybe your arms if that's more comfortable. You could even have a cushion here. And then knees are gently pushing in on that cushion, and we're opening the feet outwards, okay? And then just playing around with whichever angle feels good here, okay? Kind of trying to point the sit bones up a little bit towards the ceiling. You can see as I come backwards in space, my sit bones start to point down. So for me, I might want to kind of be a little bit more forward. And then think about really breathing into those sit bones. Again, opening up the pelvic floor. Letting the belly relax. Or again, maybe here kind of thinking about practicing for pushing. So you might inhale direct breath towards the vagina. And exhale, think about gently blowing out and directing that pressure down towards the vagina. Remember, we're working with your contractions of your uterus. Good job. Okay, nice. So other positions where we can kind of get internal rotation of the hips, if that's not accessible for you, are kind of this kind of position. This would be internal rotation of my left hip. Okay, so kind of flowing side to side. Show you from the side here. Okay, some people do really well with kind of walking their feet out wider and then letting their knees draw in. But I find that can be quite intense and uncomfortable for a lot of people. They might find that they do better with just one side at a time. So kind of just letting that one knee fall in towards the midline, walking the leg out a little bit more to get more of that inside rotation. Okay, so there's some alternatives. One thing I forgot to say is with that deep squat position, throwing a book, a nice big heavy book, under your heel on both sides, or a couple of rolled up towels if you don't have a decent sized book, can help if you're tight in your ankles. Okay, if you've had a history of an ankle fracture or something, you might find that you just can't get that level of what we call dorsiflexion. Okay, so just use props to make yourself comfortable. Remember that comfort is the goal so that your body can relax. And if you find that you're having a hard time with that relaxation component, then it might be helpful to put on a relaxing piece of music, or finding a breath practice that works for you. So kind of picturing box breathing or rectangle breathing, where we're inhaling, exhaling, inhaling, exhaling. Okay, when our exhales are slightly longer, it promotes a parasympathetic state in our body, that rest and digest, and that helps our muscles to relax and let go. Okay, so that's why the breathing component can be really helpful to kind of prep us for anything uncomfortable, because it brings us into that more relaxed state where our muscles will let go a little bit more. Okay, hopefully that's helpful, and yeah, all the best.